We move voluntarily to feel good, we move to get stronger, we move for peace of mind, and some of us move involuntarily, repeatedly. Hello and welcome to Tick Fit the podcast, a podcast where we discuss all things movement in both the exercise sphere and in life with Tourette syndrome. This is a platform to discuss Tourette syndrome and its effects on our bodies. We'll speak with movement professionals where we can advocate and educate about Tourette syndrome, while the Tourette community can benefit from the expertise of these individuals. We'll also speak with professionals about Tourette syndrome and other tic disorders. I'm your host, Raquel Cunningham, and I've been on a quest for the past 2 decades to discover the connection between movement, exercise, and our ticking muscles. This is not meant to diagnose or treat Tourette syndrome. There is no cure for Tourette syndrome. We are here to advocate and educate about Tourette through conversation, and anything in this podcast is for informational purposes only. Please always consult with your doctor before beginning any exercise program to make sure that it's right for you. Hello, everybody, and welcome. Today, I'm excited to have this lovely, incredibly intelligent, educated woman in front of me. Meghann Koppele Duffy is a movement specialist, and she is pioneering brain-based training for individuals with neurological conditions. Boom, exactly what we've been looking for. Her extensive education includes a master's degree in applied physiology and health education from Columbia University, and she's currently completing her doctorate degree with a focus on the cerebellum and its effect on neuroplasticity. She's a nationally certified Pilates teacher, she's a strength and conditioning coach, and she's been working with people with many different neurological conditions since 2004. Hi, Meghann, we're happy to have you here.
Hello. I'm like listening. I'm like, oh, that person sounds so wonderful.
She's fantastic.
No.
Hi.
Oh,
So you
hi.
are a co-founder of the Neuro Studio.
Yes.
What
Yes.
is the Neuro Studio?
So the Neuro Studio was founded by myself and my business partner, Mariska Breland. We really started because the lack of education out there. So I'd like to say the least interesting thing about Mariska is she also has MS. So we really both started out working movement for MS. So when I started out, what was this, like in 2004, I had a client with MS and I Googled, what is MS? What should you do? And there was like nothing. It was like stretch. It was kind of bad information, outdated. And even the stretching, when you understand the whys behind it and stuff like that, it just didn't make sense. So we kind of created a program and did research and tried to figure all that out. So the Neuro Studio started as an education company to teach movement professionals how to use the techniques we developed to get better results. And we also have a patient platform because, um, you know, I guess the best way to put it is this shit is too expensive for people to do. There's so many healthcare costs and stuff involved. So we wanted to have a place for people to go ask us questions directly at like less than a copay, and get some classes and resources to deal with the neurological conditions and the stuff they were dealing with. So that was really the kind of why behind the Neuro Studio. I guess education on both sides, right? Because as patients, at least most of the people we work with, they don't want vague answers. They want to know the whys. They want to be educated about what to do so they can figure shit out for themselves.
That's kind of the most amazing thing. I have a question for you,
Yeah.
and you've done such a deep dive into figuring out what is the why. But if you don't know the why, then you go find out. And that's not something that's happened with neurological conditions. You know, if
Well,
somebody
I think people have been, and part of me on the recording, I know the camera's there, but I like to look at the person I'm talking to.
I look all over
So,
the
and
place too.
and when we get kind of into the neuro stuff, is eye contact isn't necessary, although people demand it. But um, back to the whys is, I think people with neurological conditions have been a little bit settling for crumbs, not because of them, but what is being offered and the limiting beliefs and things that doctors, PTs, neurologists, other movement professionals have set for them. Like there's still sometimes a belief that post stroke, after 18 months, you're done in recovery, which is complete. I should have asked you. I think I've already said shit 3 times on the podcast,
You know what?
so
How that
it's
statistically
fine.
speaking, like here's a little Tourette education. Coprolalia only affects about 10% of Tourette's. But when people think of Tourette's, that's the number one thing they think of.
That wasn't even what I was
So
going for. Just some
I know,
people, I'm
but
from New Jersey. I tend to
I'm
say
just
shit
saying,
a lot.
statistically speaking, there will be some cursing on here. So have at it.
All right, awesome. So, and listen, when I was in school, where a lot of these techniques came about was we learned all this stuff. There was research supporting it, but the group size was small. There was limitations in the research. What they were finding was not good enough for me. And I would ask why, and really nobody had the answers. It's kind of how my brain works. I need to know how that's working. And so it's my stubbornness, but not stubbornness that I need to know. It's just my brain can't settle down until it understands something at a deeper level. And it's much easier to explain things to people when you can explain it simply, right?
Bingo.
But
Yes.
back to what I have a little circular in my conversation here, but what we kind of learned, it was almost like I call it disability porn, where it was almost like these people with neurological conditions. Oh, bravo, they stood up. And I'm like, yeah, but they're standing up. They have an increase of spasticity. They have an increase in tone. Maybe it increases their tics from Tourette's. So, yes, we got them to move, but can't we get them to move better based off their system and how their body's responding? And the thought process is, well, you can't do that. And my role here is to prove all those people wrong. You
I love
can
it.
do that.
You can very much so. And it's, I don't know, that's just inspiring won't even give the right word for that because there's more
Well,
evidence-based
yeah.
push behind that people can continue to move and continue to improve. You can't put a ceiling on the improvement of somebody's movements based on neurological
And
condition.
if you hear any athletes, you pick like maybe a Tom Brady who was a sixth round draft pick. Everybody told me he wasn't good enough. So there's going to be those people that you set a limiting belief for me. Oh, I'm going to prove you wrong. But then
Right.
there's other people, and this is I'm not putting Tom Brady that having extreme mental toughness can work against you, but there's some people they believe and listen to their doctors and they think they're not going to get better. And I have this discussion. One of my longest clients who's recovering from a stroke, he had at a very young age. I asked him, "Do you think your hand's going to get better?" And he said, "No." And I go, "Then it won't."
Right.
And he's like a brother to me, so I can call him out. But I said, "But let's talk about that." I said, "Do you want to do the work it's going to take to get it there?" He's like, "I do, but I'm just not sure that the juice is worth the squeeze." And I was like, "Man, I get that. So let's work on it." It's like actually being honest about it because
Yeah.
I don't know if I would want to do the work it takes to get that full function back in my hand. Like, if I'm being totally honest. So it's like being like, it's okay if you don't want to do that. But I would never say to him, it's not possible. And people say it to me, I have neurologists tell me what I do is impossible. And what I have gotten great at doing is I say, well, let me show you right now. Come here. Bring up like someone with spasticity. I'll decrease their spasticity when they say it's not possible. Because just talking about it, these doctors, are, I don't think they mean to be that way. I just don't think they've ever seen it happen. And why would you believe that it's possible if you've never seen it happen? Did you think it was possible that you could control your tics and stuff like that? I know that's kind of a personal question.
No, not at all. I always say I will never know for certain whether I'm part of the percentage of people that will have that just ticks decreased over my lifetime, or if it's a result of everything I've been practicing since I was 18 years old. I'll
And
never know for certain,
do we
but
ever have answers? I'll
I know
tell
I
you,
work on it. I know I
I
work
know
on it,
I
and I've
I
seen it
love that.
happen with others to some extent. I can't ever tell them, yes or no, that this is going to happen for you, but I know that we can explore this area that's never been explored before. And
And
let's do that work and see
yeah.
how you respond to it. And how you respond to it will kind of dictate the next course that we go.
And what I love, what I get to do is I get to work with practitioners like you who are trying to do the work and getting these things. And I teach you these assessment tools so that you can, like, when it's not working for a client, to me, that is the assessment. It's going to tell us exactly what to do next. And what often happens is people teach, and part of my doctorate is I'm obsessed with education and teaching, not education from the sense of getting information, but the art of teaching is,
Yeah.
uh, I always thought I was a very good teacher. Through COVID and through the work I've been doing, I realized I was a good teacher. I think I'm a much better teacher now, right? But it's still growing. So when you were saying it's a constant thing we have to do, a student once said to me, she's Greek, and it was, I'm going to butcher this, but it
I'm
was
Greek.
basically, oh, you are? So
I
it's the
am.
root of the word perfection. It was like, when you're perfect, it's time to die. That was the whole gestalt I got from what she was saying. And I loved that because we're never, once we find the answer, we're actually done. So do we ever really want to find the answer? It's that joy of the process. And that's something I really embrace, is being really connected to the process of my dissertation, writing a project, a
Right.
discussion with you, because I'm going to go back to Tom Brady, even though I'm not a Patriots fan, but he wins a Super Bowl. The next day, you're not happy. When you're always focused on the goal, you're never really happy. But I like to get in the minutia of the process. And with clients with chronic conditions, what you just said is, this is not a one-off thing. It's every day.
That's this proprioceptive awareness training. That is the process of learning how your body learns movement, how your body understands movement, how your body understands how to have the life you want to have with whatever condition it is that you're uh, working with.
And let's talk about proprioception, if you don't mind.
Sure.
I remember in a course I taught, a physical therapist raised her hand and she's like, Meg, I'm not disagreeing with you. And I love questions. I mean, my podcast is called Three Questions. It's like, I
Right,
feel like
right,
if we
right.
ask more questions, we get somewhere. But she's like, but I was taught that movement changes proprioception. Like, that's actually an assumption, because how we know where we are in a space, what determines our proprioception is going to be sensory input to the muscles, the tendons, the joints. Some people respond to a stretch, some people respond to the slack, different things. So oftentimes when we're doing exercises, we're not changing and improving our proprioception, we're actually reinforcing where our brain thinks we are. Now that can be that can get wonky, because I don't want people to think that every movement session we have to create a new movement pattern. I mean, I like
Be
this
a
idea of,
lot of
if yeah, but I like the idea of, if we learn something new every day, not a big thing, a little thing, right? So even just a shift in the hip that was interesting, or something like that, that we're adapting to our body. And something that I find very interesting about Tourette's, what you said, am I just one of those people that it was worse in adolescence and I grow out of it? Something I don't see anybody talking about is the proprioceptive shifts through adolescence, when we're having growth spurts and getting our period or increase of testosterone. What happens in menopause for women when we get less sensory input from our stretch reflexes, our connective tissues different, our muscle? Our body responds to information different throughout each cycle, based off hormones, what we eat, what we sleep, all the shit, right? So yes, and what if we, with adolescents, gave them tools to adapt to the changes in their body uniquely to them as they're going through that process?
that is what is that? Needed, necessary. Like, let's go. Let's do
Let's
that.
hold on. I'm going to ask you a question and you got to be honest with me.
Tell me.
So I know what it's like to be a teenager. I People always think I was an athlete because I like played sports and I talk about sports a lot. I was like average at best at sports. I'm not naturally a good mover. Okay. I had what's called like Osgood Schlatter's as a kid, which they call
Okay.
like growing pains. I had one
Yeah.
growth spurt. I'm 5'3". So I would always, I had a lot of ouchies as a kid. Mom, my knee hurts. Ma, this. And my mom would be like, well, don't do that. Okay. So as a teenager, would I have really given a shit and done the things. Now, I'm going to ask you, would you have wanted to do all that work and get into the minutia of it as a teenager?
I chased it. And the thing that stuck with me from figuring that out as a teen, and I've seen work with people when I worked with them with different neurological conditions, is when they get that aha moment from sensory feedback.
Okay.
So
Now,
I would be upside down, like just hanging out in a handstand, and that just felt good to me. So I had to keep doing that.
and what's
Swimming.
interesting,
Yeah.
we all like to think, well, swimming, what I'm hearing too, and something I look at with Tourette's is actual vestibular challenges. So the fact that you like being upside down was probably less of a proprioceptive, but more of a vestibular challenge. And we see that in autism, or I see it in a lot of ADHD, which can be, it's not a guarantee that you have ADHD and Tourette's, but they do find that sometimes those can be coupled.
Very high
Um,
incident of comorbidity there. Yes.
so all those things is a lot of those people. I'll use my husband for example, and he loves when I do that. He was a very high level athlete. Um, he can't sit still. He needs vestibular challenges to calm him down. He has he doesn't listen to podcasts. He has tics. Doesn't understand them because, and it was funny. I can't speak for your experience, but all his buddies. What do you think they do about his tics?
I mean, you always assume teasing first, unfortunately. You do. And
So, and I don't want to assume that maybe you've got more skin in the game, because any of my movement issues or my anxiety as a teenager, nobody knew it was happening. But if you're having a tic or an outburst, I am assuming that people see it. And as a
yes,
teenager, doesn't everybody just want to fit in? Like as
the
adults,
pool,
we want to stand out,
right?
but as teenagers, we're like, don't look at me.
Blend in. That's where the pool became a safe place too. I mean, I know so much more now, obviously, than I did then. If I knew that being upside down was part of the vestibular system, I could have looked up what are more things like that, and that could
And
lead
in
the
the
path
pool, think about
in the
all the head
pool.
movement, like,
Oh
which is
man,
why I
there
don't
were
like swimming, too much head movement.
but that was a place I could let all my ticks out. And if it was a high tick day,
You would
there
be in
they
the
come
pool.
out. I'm breathing, I'm doing weird things. And in the pool, like you might be in a lane with 8 kids, and there you are swimming in a line. And if I'm ticking, I'm holding up the line. Somebody would ever, you politely tap the person's foot in front of you to get around. And I was so inconsistent on where I was in the line, whether I was the second or third one or the last one, depending on my ticks. There they come out underwater, my toe, my breath tick, a head tick, a hand. I had a lot of bruises on my hand from smacking the lane line. And, but that's where they came out. But that's also what taught me rhythmical breathing was important for me and my body.
Yeah, and that's interesting because with swimming, one of the reasons why I wasn't a great swimmer is um, we have a joke. My business partner tried to teach me, my husband, I like really can't, I don't float well in the pool. And they're like, well, maybe you float underwater. And then like literally they're like, oh my God, what is wrong with you? But like my husband, like he can float. Like I feel like he's like out of the water, but he has really good breath control. As you can hear by my voice, is I from my concussions and my head injuries, it really affected my cervical spine and voice. But I don't think I was ever good at breath control. So swimming, you kind of can't swim well without breath control.
Your breath is rationed. It's the only sport where your breath is rationed like that. You don't run and take one breath and then you only get 3 steps. It's rationed. you get
Organized.
It's organized. But it's funny, after I graduated high school and went into college, studied psych and exercise phys, and then after I stopped that, the first certification I ever got in the training movement world was Pilates. I
Oh,
had never
interesting.
stepped on a reformer. I had never taken a class. I had
You
done a
just knew
little
you
bit of
wanted to
mat
do
work.
it.
I knew it was movement, fluidity, and breath. Like, well, that's
Yeah.
kind of like swimming. Like, let's do it. I did it through Physical Mind on the Upper East Side with Lauren Piskin, and that was my transition to land movement.
That's
And
great.
the fluidity of it is incredible, and that's where I started learning about the minutia of how my body worked. And I find that whole process incredible. I'm like, okay, well, how can we continue doing that? And then I just kept chasing movement,
And finding
which
what you
means
like.
finding what I like, which was everything. It's kettlebells, it's stick mobility, it's Viper. I just kept chasing movement.
And you know what's so interesting about that is there's two types. Well, there's more than two types. I don't mean to generalize, but I find there's two types of movers. People who are don't get bored easily and people who get bored easily. Like for me, I never like to do the same workout twice. I actually can't. And I teach an advanced, like a neuro-based movement class every Thursday to our Neuro Studio practitioners. And I started it over COVID on Zoom. So, in a way to connect with people, because what the fuck, COVID was weird.
Yeah, that
So, what was that in 2020? It's now 20, there's never been people like, and so it's not traditional Pilates. I use a lot of classical Pilates, but I don't follow the same thing because not everybody's brain benefits from that. And what happens, I was starting to make this point and I went off because I do that, is people teach based off what they like, not because they're selfish, but it's so freaking meaningful and powerful to them. This changed my life. So the assumption is it's going to change someone else's life, which it can, but not with the same teaching style. I did very well in school. I love lecture. I'm an auditory processor. So once I hear something, that's how I process best. I do not like reading and comprehension. I prefer to hear it. A lot of people, so I used to lecture a lot, and people say I'm a great lecturer. This is what people say.
I'm
But a lot
enjoying
of
it.
people, but a lot of people liked what I was saying, but they weren't learning anything because for them that really didn't speak to their learning styles and what did that to them. So that's where I'm really fascinated with movement education. I think there's a lot of methods out there, like everybody and their mother has a method, but they are not teaching it to people, giving people the skills. And how do you know you're doing it right? So to me, I use the cerebellum, or the hypothesis that it is the cerebellum, of using it to, are you doing that kettlebell swing correctly? They're determining it based off somebody's watching you, and based off alignment, they're determining it. That's not actually a great assessment. What I like to do is, how is your visual, vestibular, and proprioception working together? So when they'll say, pull your head back, do all this, you're actually taking me out of my natural patterns. But if you use my natural patterns to assess, you can see what my brain thinks is the most efficient pattern. And we can teach and change patterns based off that. I know that seems like kind of a big thing. The assessments are not that difficult and it is subjective, but we need to figure out ways, because clients always ask me, am I doing this correct?
Right.
What's correct? And the research does show that alignment-based training does not necessarily decrease pain. I work with a lot of the top movers, and all of them have perfect alignment, and all of them live in pain.
I have a type 2 grade spondy. I will never be in perfect alignment. And
Nor should you.
right,
I
but
don't
there's
think you
ways
should.
to move.
Yeah.
You know, you've
And
touched upon a really interesting, I think this is what makes you a great teacher, is that you understand how people understand movement and you can teach to that process. Again, with Tourette, and there's so many other comorbid conditions with it, you know, ADHD, but learning how you learn is one of the most powerful tools that you can get in adolescence. I'm a kinesthetic learner, not an auditory learner. And I didn't know that until recently, but that's why I kept chasing movement. So had I known, okay, this was vestibular, I can keep trying these other things to learn more about me. There was a young man that I worked with, an incredible athlete, and he did not have tics, but he had a visual processing disorder. So you could say something, you couldn't do a movement and have him mimic it. And so, well, what are all of these other cues? I had to talk to his body in feels. Do you feel this here? Do you feel this here? His name was Luke. And he helped me put this idea of just remember Luke. Learn how you understand movement, keep going, and it will be effective.
I love that.
And I to teach to how somebody learns is what's going to help them propel to these and break through these ceilings that people have told them that they can't break through.
Yeah, and you know what also is so interesting? I do this thing with all my teachers, and one of the questions I ask them, what is happiness? And they're all like, I'm like, what makes you happy? And then I'm like, oh, my kids. I'm like, can't be something external. What makes you happy?
Yeah.
And I realized what makes me happy is doing laundry. And they all laughed. It's not the laundry. It's a task that you start and finish. So for me, now my husband and I define laundry as two different things. Brian defines laundry as putting it in the washer and then sometimes putting it in the dryer.
The initiation
Like
of the process
like
versus the
last night,
completion.
there was like a basket of clothes. I'm like, do you want me to fold those? And he was like, but no problem. He does other things that I don't want to do.
Right.
For me, I love laundry is really great for anxiety for me because when I'm feeling anxious or out of sorts, I know I can start a load, finish it, and it's like, okay, I might have not gotten anything done, but I got that load of laundry done from start to finish, right? So it's figuring out like what is your happiness, and why I bring happiness up is it's very different from people. It's not the opposite of sadness. And people think like happiness is like it's kind of being just content for me. Now, going back to talking about sensations or different somatic methods, I think they're great. Yes, and how you're describing a sensation is not how everybody feels it. So we teach assessments on how to actually assess stability. I still see all the time people going, this is a hip stability exercise, and they're mobilizing their hips. That is not a hip stability exercise. You are mobilizing your hips, you are stabilizing your spine. So, and it's not because they don't know, but because words completely lose their meaning when we use them so much. So, when we're talking about what does this feel like to you, I love that you asked that. Like, what does this feel like to you? People are like, I don't know. And I love asking people what stability feels like. When they actually feel it and they have that aha, they're like,
I
there's
love
no
those
word.
moments.
But
I
I go,
love that
it feels
moment.
like this to me. Oh, sorry. And if you're not watching us on screen,
Oh,
I'm
great.
like I'm shaking my fingers and head. I, stability to me is energetic flow. So it's not a movement tremor or a cerebellum based tremor that people think like, when people get those like in Pilates, they'll get that shake and they think it's a
Right.
great thing. It's energetic flow for me, but that's not how other people feel it. I've had a teacher tell me it's colors. So she sees it, the color kind of explodes versus being trapped. So it's these conversations are so cool because it's only weird if it doesn't work.
Right.
But I like to bring more science behind it because sometimes when you talk woo-hooey, people think it's woo-hooey. It's all based on science.
It's very much as I've actually had somebody describe that as well. A color, like a sensation affiliated
It's
with a certain movement.
There's a name for seeing in color. It's slipping my
I
mind.
know there is.
I'm bad with names of things and sayings. I always say them backwards. But it's just so cool. But like if you're listening to this and you have Tourette's or you have anxiety or you have ADHD or you're autistic or you have a neurological condition, maybe make your goal is your person's going to give you an exercise. Ask them what their goal is for the exercise. What's the goal of the exercise? Well, I want you to do this because I want to challenge your hip flexion in this position. Then I want you to do the exercise. And if whatever people critique you on, that's what they're observing, how they want you to do it differently. You don't feel that, right? When they're like, oh, just rotate your hip more. It's like, oh, I thought I was.
Right.
It's crucial. What we do at the Neuro Studio with the assessments is teach you how to actually feel through a sensory channel the mistake you're making to help activate your cerebellum, because your cerebellum is what will create a new motor map to create that new movement pattern. So if your person's saying, okay, you got to drop your hip more, Well, maybe put your hand on your hip where it's lifting so you can feel that it's lifting. Because if your brain, just hearing it, if your brain doesn't have actual sensory awareness of the desired and the undesired movement pattern, we're like yelling at a deaf person. You're not going to hear. And
Cueing becomes huge, and appropriate cueing for that person's needs.
Yeah. And we how I look at it is I actually want the cerebellum to be the teacher. So I don't actually cue my clients at all. And that's actually a lie. Because the definition of how you and I are talking about cueing, I know what you mean.
Fair.
Where it's going to sound like I'm saying what you're doing is wrong, but that's not my intention. Is I don't tell a client what I want them to do. We discuss the goals. So I don't want to focus on the motor output, which is what we were taught in school. It's all about the motor output. But guys, what changes the motor output is sensory input, which is not just feeling, it's auditory, it's visual, it's vestibular, like all those things. And all of you respond to a different sensory cue. So what I tell my clients is if it's not a yes, it's a no. If you're like, hey, did you feel that difference? And they're like, it's a no. It wasn't sensory enough for their brain to create that shift, right? And what I'm working on scientifically is the assessments for repetition. So if you guys have heard about neuroplasticity, like, oh, you got to do repetitions, more reps. You got to do 10,000 reps to learn something. That is a totally vague number. And I think it's that high because people do each rep differently. So the methods that I created help with precision. And the definition of precision is not doing the exercise better. The definition of precision is doing it exactly the same. So if you guys took a big bullseye, right? If my face is a bullseye, hitting me in the nose would be accuracy. That's very accurate. But say I kept hitting my chin and I kept hitting my chin in the same spot. That's precision. Precision is not hitting the chin, then the nose, then the eye, then the nose, then the chin, then the nose, then the eye, right? And I think those words get mixed up and they're just words. So who cares, right? You know, what we're looking to assess is how the hell do you get good repetitions that are precise? Because if we want to create a new movement pattern, create safety in the brain, the proprioceptive shifts that you work on, well, we need to be able to replicate that. How the hell do we replicate it? So that's why we do use these sensory assessments. And it'll be like, let's do one right now. Okay. So for example, I want everybody to look their eyes to the right, like as far as you can to the right, and then back to center. Good. Do it again. Okay. Now, some of us, our spine and jaw stabilized. Some of us, our heads moved a little bit. Some of our jaws moved a little bit. The problem is if your jaw or neck moved, you're not stabilizing, so you're actually not isolating your eyes. Now, if you don't feel, like if you said to me, look your eyes to the right, I'm moving my head a little bit. So then you say to a client, okay, well, don't move your head. And they're like, I'm not. So what I want everybody to do is bite your tongue gently, don't bite it off. And now I want you to look to the right and back to center without your tongue shifting in your teeth or biting down more. Did that feel different to you? Did it feel different for you?
For me, I had a smoother, as the prevalence of eye tics, huge. So like what a great simple thing. But
is that common in most
different.
people with Tourette's, or is that personal to you?
I would say that's neck tics and eye tics are incredibly common. I would say that's high.
You're
for many,
Ted, you're it. Here's what I want you to work on. Okay. So, number one, why my hypothesis that is the case is because most people can't differentiate. So, we've got muscles of our eyes. I call them your eye abs.
Mm-hmm.
People can't differentiate eye movement from jaw movement, from facial movement, from neck movement. My client, literally before this, her eyes, every time, even when she closed them, when she looked up, her eyes would open. And she's like, no, they're not. And I videoed her and she's like, holy shit, that is so friggin' weird. But her eyes were fluttering so much, which was like a nervous system response.
Right.
She doesn't have Tourette's or a neurological condition, but she is She's a pretty remarkable person, very empathetic, reads a room, is one of those women who takes care of everybody very well. Does that make,
So
one of
she
those
understands
people
their needs. She's there like on a like
before
I'll
people
catch
do.
you. Yeah.
Yes. So she's taking in a lot. So I was saying, I'm not concerned about this, but I think if we can work on this, it will help your nervous system calm down. And I literally had her touch her eyes. And the specific her touching the eyelid, the eyelash line, they fluttered more. When she touched the actual eyeball, pressure to her eyes without moving them, it completely calmed her down in a way I'm like, dude, that's crazy.
The thing that
And
works is the thing that works.
for her, she did not realize she was moving her eyes so much. But guys, why that's important is if you're moving your eyes so much, we think what we see is what our eyes are taking in. Your eyes are taking in way more information than you see. And your brain has to process all that information and then create a picture. So, if your eyes are taking in so much information, could you understand why someone might have attention deficit disorder or ADHD, or their brain is in overload and can make their tics worse? I mean, like, this is just logical, right?
Very much
So,
so.
it's like, I am going to tag your it for Tourette's. It's how can we bring awareness, differentiating eye movement from jaw movement, from tongue movement to spinal movement. And I made you bite your tongue. Now, I could have told you to put your tongue on the roof of your mouth, but like, put your tongue at the roof of your mouth right now. It's a little low risk. Like, are you really going to pay attention to that? With my clients, I'll put a piece of
Fair.
candy, right? So
Yeah.
for me to get the tongue at the roof of my mouth, if I swallow, that'll set your resting tongue position, swallowing, right? But people lose focus on that because it's not interesting. Biting your tongue is high risk, right? Because if you look to the right and your jaw shifts, your brain is getting that information and doesn't want to bite your tongue off. So it's a little bit higher risk, right? So,
Right.
you could have just, let's look our eyes to the right again and just make an L with your hand, touch your sternum with your thumb, and touch your chin on the right side with your pointer finger, right? Now look your eyes to the right. Do you feel the pressure change at your fingers? Do it the other side. Okay. Now, two things. You might have been like, no, I don't feel the pressure increase. Yeah, because you actually stabilized your jaw and neck.
I work on
Or,
this daily, right? So like the
yeah,
visual, like if somebody's watching this, it's just something that I practice. And if you would have asked me to do that when I was in high school swimming, I wouldn't have been able to. I would be looking
Jess,
different directions, head different.
and what you can do. So, if you guys have head and neck tics, don't, I don't know, I don't like these words. Let me say them and clarify. I just don't know if I have the right words. I want to say don't fight it. And what I don't mean is just let it go, but what I mean is if your eyes, like when you just did that, your head and eyes moved in the same direction. So that would be interesting to me. So I would make you do an exercise. I want you to move your head and eyes in the same direction. So that's what your tic wants to do. That's telling me your brain prefers what's called a BOR cancellation, which is just you don't turn your head and eyes in opposition. They like to go together. Your
Right.
vestibular system and your eyes prefer to get the same information, right? So showing your brain, okay, we can do head and eyes together. Look, we're doing it. But now maybe look at one point and just turn your head to show your brain it's safe and they're different things. A lot of times they'll say, oh, she always moves her head and eyes together. Let's teach her how to move her head and eyes apart. Screw that. Teach her what she's already doing so you actually own that motor output. It's not involuntary, right? And I work with more people with Parkinson's than Tourette's. A lot of people who have increase in spasticity or tics, but from neurological protection. But I can speak of a Parkinson's client. He has a big family. One is hand tremors. What does everybody do? They're worried about him. He has in better health than all his siblings, right? But they see the tremor and they worry. Is his Parkinson's getting worse? No, he's just having a tremor because he's having a drink and you're all talking and it's stressful and there's a lot of people talking and they're all loud, right? So I always say to him, I know this is so much easier said than done. And if somebody said this to me, I tell them to F off. But the more you try to stop the tremor, the actual worse it's going to get, because your brain that's what your brain wants to do. So you fighting it, the brain always wins, guys.
Isn't that the truth? That's the nature of why they've proved that suppression doesn't work. Suppressing your tics, holding them in, will make them come out worse and stronger.
And
So,
I
like,
imagine if I'm in high school and my tic is an auditory of talking, you are going to be so nervous at yelling out, you're trying not to.
right.
And then I assume it comes out worse. It's almost like, I always use an example, everybody laughs. It's like, you can't fight your body's natural thing. So I always say to my students, remember, if you have to sneeze and fart at the same time, don't hold in the fart. You'll shit your pants. Meaning, like, fart and then sneeze, or and again, I'm half kidding, but serious.
Right, but
It's involuntary. If you try to stop yourself from farting and there's a sneeze, it can end badly.
something
We'll put it
worse
that
is
way.
coming down the pipe.
So, but I think that's very easy to say. Oh, just let your tics happen. Again, if
Right.
I were you, I'd be like, shut up, bitch.
No, but we want to educate the world on Tourette syndrome. That these tics are there. Let them be, learn about it. But at the same time, my whole quest is to help people with their tic-related pain and to explore these areas that have not been explored with movement and other neurological patternings, like what you're talking about. You've described so many different things in there about what CBIT is, which is kind of the premier treatment for Tourette syndrome, which is proprioceptive awareness training, being aware of your premonitory urges, looking for competing responses, which is doing the opposite motion of that first tic urge. You described it all there. There's a world in there where people can figure out what their body responds to that could create a reduction in tic urge itself, which would be ideal. If you can
Yeah.
find a way to reduce that urge, if it could reduce the tic frequency, or if it could reduce the tic intensity. There's a
And
way to have a reduction in each of those.
I think all these, I mean, it's what I go through. It's like a lot of the people who take my courses, they're like, oh my God, that was kind of what I was already doing, but I didn't know the whys. Now I have the tools to assess it. So, like,
Yes.
that's kind of my job. What I say to teachers is, I'm filling your knowledge gaps. Don't throw the baby out with the bathwater, meaning, like, do not stop what you're doing. Use
Right.
this as a lens to assess and lead, because, like what you just said about that method, they're teaching you to, what is the tic? Do the opposite. Yes, but prior to that, maybe doing what your tic is first. So it's almost like leaning into it, creating slack, less tension in the body. And I feel like this is the easiest way to describe leaning into it is with stretching. Okay? When we stretch, right? People go, "Oh, my hamstrings are so tight." Right? And I'm looking at them and I'm like, "Yeah, because you're stretching them." But we were taught that if something feels tight, you should stretch it more. And my theory, which it's technically theory, we have research to support it and clinical evidence, but like it's not peer reviewed yet and stuff like that, is it's not about stretching that tissue more. It's about bringing the rest of the system to the party. So if you're bending over and you feel a stretch in your hamstrings, it's mostly because your glutes aren't freaking lengthening. So your pelvis is stuck and you're literally overstretching your hamstrings. So what it is actually doing is you're disrespecting what your brain is telling you. Your brain is telling you, stop friggin' stretching me. There's other tissue in the body that can help here. But then we overstretch it. And yes, stretching can help. It changes sensory input. But when you stretch, you actually deregulate your stretch reflexes. So then your body doesn't respond as appropriate. So I always want my teachers, the people I talk to, is anybody who says this is happening, I want you to be like, okay, why could that be? Let's go one step deeper. We don't assume, because I think the assumptions helps about 35% of the population. And then the other 65% is like, that didn't work for me.
Right. I feel like what you're describing is joint centration.
Oh, well, it is, but the misconception about joint centration is that it's alignment based. So what we do, the first thing we teach in my advanced course is what joint centration actually is. And it's creating slack in systems and actually finding where the joint is centrated so that the body can have a reflexive response rather than a gripping pattern. So step one is always joint centration. And guys, most of us do not move with joint centration, mostly because all the joints are very close together. Our brain can't differentiate. So step one is joint centration, but then you have to change the map in your brain. Because if you want to keep glenohumeral centration, but you can't differentiate between your AC joint, your glenohumeral, and guys, they're this close together.
And
They're
if you
very
can't see,
close.
she's holding up like half an inch there.
So like it's like the bone of your arm bone and where your clavicle meets your scapula, they're so close together. So whenever people have rotator cuff injuries, it's usually because they can't differentiate. So if we can't have our brain have awareness between those two joints, you can't actually keep centration. So it's actually hard. So already, what's the best way to say this? Keep doing what you're doing.
Keep going and it'll be effective.
What I'm going to challenge you, because this is what I do to teachers. I work with exceptional teachers, not because I'm choosy, but they like to know the whys. I want everybody who's listening to this, because they're going to be high level learners, is just ask why for everything. Be annoying. My professors didn't like me. It's not that they didn't like me. I actually didn't ask a lot of questions because I didn't want to be annoying. And then I would just figure it out myself.
I'm a mix of both. I ask and then chase. I ask and then chase. And
because usually nobody gives you an answer that's helpful.
Fair.
Very
yes.
rare. I remember one professor was like, "Oh, well, people get low back injuries because their multifidi turn off." I was like, "Really? That's fascinating. Why?" And he's like, or she was like, "Because your multifidi turn off." And I'm like, "No, I'm not deaf." So like, why do the multifidi turn off? And she was like, "Because, okay, so what happens is when your multifidi," she did not know why. And I don't know if there is a definitive answer why, but usually the reason why is because people can't differentiate the joints of their lumbar spine. So they're not actually using their multifidi. They're not rotating, guys, intersegmentally or doing the movements that would require the multifidi. So these muscles were never active. And the brain actually thinks that the lumbar spine is one joint. So they move at one segment. So you don't really need your multifidi. You just use your QL. So it wasn't that the multifidi turned off, or all these techniques where they do muscle testing. Oh, your muscles aren't active. They're not active because they don't need to be, based off the sensory environment you're creating. So if you want those muscles to be active, just pushing on them ain't going to do it. You've got to change it at the brain. But it was fascinating to me. This top level professor, that was her answer to me.
See, that's wild. That's where we
Because
need more
somebody told her
conversations
that.
like this. Yeah.
And what she did was she would get people's multifidi to activate. It's an exercise called ballerina or something, where you put someone in a little hip extension and pelvic rotation. So little intersegmental extension and rotation in the lumbar spine, isometrically hold it. Their multifidi turn on, their back feels better. But then they get up and walk and the multifidi off again.
Right. Then
so somebody told her that. She found it was a great solution, but never asked why. And she was a great practitioner. She wasn't bad.
Using principles that do exist, but then challenging them for neurological conditions, the principle of sport specificity. If you want to get better at something, you have to do that motion, but there's tick specificity. People get really good and proficient at doing their ticks to the point where they have to satisfy that tick urge. So going back to your point,
stop for a sec. I want you to repeat what you said again, because I thought this should be your social media post. Go back to what you said before about taking principles.
Taking principles that already exist and then challenging them with, I don't even remember what I said, and then challenging them with how to apply for neurological conditions.
And dare I say, we all have a neurological condition. We're all human. Everybody's a neuro client.
Everybody. I couldn't agree more.
But here's the thing, why I like working with neurological conditions is you guys have more skin in the game. You care, you focus. Where some of my clients, they don't want to do the work it takes because they don't think it matters until their injury gets so bad that,
Right.
so
That's when it happens. That's when people become engaged and interested because then
I
they've
say to
had an
my clients,
injury or because, yeah,
I'm not going to chase you. I said to my dad, his
yeah.
ankle was on backwards. And I'm like, Dad, here's the deal. It's obviously not bad enough, or you're not in enough pain to do anything about
Right.
it. Because I work with people who he's like, well, Meghann, my doctor said I have a bit of arthritis. I'm like, who doesn't? That's not
Yeah.
an excuse. But, and I'm not being hard on my dad. I'm just being honest, right? But I love what you said about the sports specificity, pardon my pronunciation. I just had this conversation. I was just working with a golfer and he was in pain and his gait cycle was off. But his gait cycle was off because he is golfing the best he ever did. And we've been working on, I don't do golf specific workouts. We help open up those movement patterns via the brain. And I told him, I pulled up a video of Scotty Scheffler, Rory McIlroy, and then I videoed him, and then I videoed me walking. I go, who do you walk like, me or Scotty Scheffler? There's a particular gait cycle in golfers where they don't differentiate their lumbar spine from their hip as much in a traditional gait cycle. And he goes, are you telling me I walk like Scotty Scheffler, who's like the number one golfer? I was like, yeah. So I said, listen, I actually, traditionally, we would be taught to fix that movement pattern. And I said, I'm going to tell you why I'm not. Because that movement pattern is amazing for golf. It's not great for walking. But what do you want to be better at right now? And he said,
Right.
golf. And I go, so I said, but I'm going to make sure your brain knows it's safe to do both of those. But just what you said, it's like with the tics, it's like, this is what we do every day.
Yeah.
Maybe we should get better at doing it and in control of it.
Well, to your point, like how you lean into something, if we have this tick specificity, then you have to train your body knowing that that's part of your motor map. How can you expand that motor map to centrate your body around those patterns that will continue to happen, but also make it in a safe environment and try to help introduce other movement patterns?
And I think what you're doing and what I like and why I wanted to agree to come on your podcast was you're a disruptor to the industry. So you're going to have a hard time you're not going to have as much followers as the people just doing exercises for Tourette's and stuff like that because you're a disruptor. You're pushing the envelope because some people will say, oh no, that's going to make the tick worse, right? Or they don't want to lean into that. But what I think you're doing is super powerful. It's going to help a lot of people. But as a disruptor in the industry, it's going to feel like you're fighting against the grain. You're not. You're just trying to hold people accountable in the industry. And I'm not talking to the patients.
Right.
It's really, practitioners need to pay more attention. People want a black and white answer. No two humans are the same. There is no black and white answer with humans. And I hope, I don't hope, I know you're going to stick with it. But it's just encouraging to hear your understanding, your expertise, where you're looking at it. And, if I can be any of assistance to help you find tools to make your job easier, I would love that. But I feel like keep fucking disrupting.
That I will do. I have no intention of stopping. It
And I love it when I'd say, stop telling me what I should, stop shoulding me, right? Or they say, oh, that's not possible. Please stop talking while I'm working. Right? Because they're telling you what's impossible. And what I want you to hear, I don't think your tics got better because of age. I think your tics got better because of how you've adjusted your body to shift through age. Now, most people, their proprioception might improve as they get older. Some people gain weight as they get older, and that weight helps them proprioceptively. Some people lose weight and they do proprioceptively. So I'm not saying that age changes the Tourette's. It's really how your brain is adapting to those proprioceptive shifts. So what I don't like the conversation is it sounds like it's taking away the value of all the work you did. It's like, yes, and I think for you could give people the power that they can, if they don't like their proprioception, they can change it. Is it easy? No, it's not. the
That's
same thing
kind
with
of
weight loss. We're seeing with the GLPs now. Sorry, I'm all
right.
over the place. It's
No,
like
you're
it changes your response to your stretch reflex in your stomach. So what I've worked with a lot of very hypermobile people. I work with a few people who are very overweight and very hypermobile, or people who are very low weight and hypermobile and have digestive issues. And a lot of it is because their hypermobility is also not just in your muscular reflexes, but the stretch reflex of your stomach, right? So they don't feel full until they are so full they're sick, or they feel full immediately when they have one bite of food, right? So guys with your how we can equate this to Tourette's, it's if you guys can train your stretch reflexes, train your motor maps, train your body's ability to change and adapt to sensory responses, especially when you're overwhelmed, that's critical. Me telling you to just move and strengthen and weight train is the same as me telling someone who's very overweight to just eat better.
there's so many more hows there. I feel like we could have a whole other conversation on Ehlers-Danlos and hypermobility. I've had a fair amount of clients with that as well, and there's a similar approach to that. I mean,
And
completely.
I've seen with Tourette's, and there's a difference. You don't have to have global hypermobility. A lot of people will see this in athletes or people with excessive tics where they're very hypermobile,
I
where they're
agree.
excessively moving. So hypermobility, and what happens is they're telling people like, don't hyperextend your knees. And I'm like, well, how
Right.
the fuck are they going to stand up? So we
Right.
have a rule at the Neuro Studio. We call it you add, you don't subtract. So I don't tell you not to do something. I need to teach your brain another option and make it efficient enough,
There
because
you go.
if I don't do that, then you're stuck in that fucking pattern in hypermobility. And I see with my husband, his is a hand related,
There's a
but
lot of heuristics, yeah.
what's interesting, but it's also sound for him. It's the sound it makes. And the sound makes me fucking crazy because I'm auditory. So it's one of the many reasons we don't have children. I need one auditory at a time. But what I realized is, so when he's doing it, I have a strategy that the auditory doesn't make me want to scream at him. So it's so interesting about what I've been noticing on his hand. Like he's got his shoulder of that hand is a mess
You look at the
because
chain.
the hypermobility in his hand is creating bad sensory intel to the shoulder. And it's his, so he had posterior dislocations from football. So it's
Oof, okay.
his good shoulder that's bad because
Oh boy.
it is so hypermobile. So it's like it makes me crazy because like, can you work on my shoulder? I'm like, not that one.
Right. I see a
But
huge incident with hypermobility as well, but to your point that it doesn't have to be global, right? It can be isolated areas.
it's
And
almost
it,
better if it's not, don't you think? Because
I
global
do.
hypermobility
I
is
do.
tough. It's
It's
tough.
incredibly tricky. It is to going back to talking about precision and accuracy, it is really difficult to learn precise movements with hypermobility.
Especially from a proprioceptive. That's when we really
Mhm.
bring in the visual and the vestibular components of it. Because I just did a post about, I have a scoliosis workshop coming up. It's
Ooh,
like
I would
when
dig
you have
that.
scoliosis or hypermobility, your proprioception is your weakest link. Why are we leading with proprioception? What if we led with other sensory systems?
Mm.
But when we think of movement, we think of muscles and feel. Your eyes, it's not that we're using your eyes to strengthen your body. We're using your eyes to give your brain the sensory information to create the correct motor output, right? So it's like, and I think if we just explained it like that, but then there's these neuro trainings, I won't name any names, but they're like, oh, look, if you do this eye exercise, your range of motion changes. And it's like, yes, because your eyes probably were not gaze stabilizing before when you moved your shoulder. And if you don't have stability, you can't mobilize. Or by doing that eye exercise, it helped your jaw and cervical spine stabilize so you can mobilize. So it didn't fix the global pattern, but it gives people the wrong idea that there's these magic neuro hacks
Right,
that
I was just gonna
fix
bring
things.
magic to that. Yeah, it's the body is not magic. It's
I I hate that. And I have a lot of very intuitive teachers, some of my mentees who do Reiki and stuff. And I say, stop saying you're a witch. It's diminishing your skill. There's science behind that. They're sensing energy at a different level, or the one who sees colors. She
Right.
sees that. And I'm like, that is not witchcraft. You're using a different sense. You see something I don't. Like, don't diminish your expertise and that you're so great to, oh, it's just like witchcraft or magic. Like,
Right. No, there's something behind that. There, yeah.
so
I do.
I didn't ask before. I apologize that an hour in. Is your name pronounced Raquel?
Yep.
Okay. I am not great with pronunciations, and then I got embarrassed that I didn't ask, so I just, wanted to
I
know.
ask all the time. I bumble my words all the time.
So we are going to bring you to the dark Neuro Studio side of teachers. That doesn't mean you have to take all the courses and stuff like that, but we're very blessed. The teachers that the Neuro Studio attracts, we preach abundance mindset, not scarcity, meaning we can all be successful at the same time.
Agreed.
So it's what I'm going to say to you is thank you so much for giving me the platform to share, rant, talk about 20 different things in a circle. I like to be chaotic on podcasts. And the reason why is maybe something I say resonates with you. Maybe it doesn't. But I'm a chaotic person. So that's it.
I very
Not when
much
I'm
am.
teaching.
You're focused when teaching, and yes,
But I really appreciate it, and I'm really excited to learn more about you. Share with other people your resources, because it's really critical, because people think that it's not possible what we're saying because they haven't experienced it yet, not because they're doubters.
bingo. You have to experience it and feel it. And there's a lot of very educated guesses for here's a bunch of things that you can try that you will feel something that will allow you to motor map. And again, I love that idea too, that you're adding something, you're not subtracting. Here's a lot of things that you can add. Which one works for you?
And you are one sensory input away from a positive, dynamic life change. But you are also one sensory input away from a tic, a nervous breakdown, spasticity increase, balance changes. So being able to assess and identify that, and even you're going to have tics. I'm going to have dizzy spells. I'm going to
Yeah.
have post concussion issues. But when that happens, I know where I can go. I've got to go back to step one. And it's not that I've got to go through the whole process again. I've got a place to start. But I just always
Right.
remind people that, like, you are one sensory input away from, like, your life changing in a positive way. And you're one sensory input from the wheels coming off the bus.
Right. And then where do you go? What are your tools to get back to your baseline? I do have one question for you. How would you describe the difference between, because we've spoken about a lot of different neurological conditions,
Mm-hmm.
Ehlers-Danlos hypermobility, not neurological, but affects the nervous system.
Mm-hmm.
How would you describe the difference between a tremor, spasticity, and a tic?
So spasticity is a protective response off from weak muscles. Now, it's controlled by the brain. So, what often happens when somebody, it's usually velocity dependent. So, if somebody moves fast, they'll get in. Usually, most people have tonic spasticity, where it's an increase of tone. But also, if I move too fast, I might get an increase in tightness. That's different from spasticity. However, I treat tightness and spasticity the same way. Spasticity is, I think it's easier to manage because it's not, there's no maybes. Like, if you post stroke or MS, your foot will turn in or your hand will do this, right? So you kind of can't hide it. Where a lot of my clients will be like, do you feel pain there? Do you feel tightness? And they're like, no. And I'm like, yeah, you do. I can tell.
Mm.
So with spasticity, we're looking to get the brain back into control. So when you're dealing with spasticity, you can't stretch spasticity away, but that's the protocol. All that's doing is changing the response at the muscle. But what we do is we bring reflexive stability to these high payoff joints, depending on the situation, and integrate the senses. So a lot of my clients, we map new movement patterns because the brain is deeming that unsafe. So we then have to find safety to decrease spasticity. We then remap that movement. I know that sounded a little technical. We even post-stroke do passive range of motion. So rather than just stretching the shit out of people, we're assessing what the rest of the body is doing. So spasticity is usually due to upper motor neuron damage in the brain. It's a reflexive response, but it's a failure of the stretch reflex. Okay, so the brain loses control. It usually becomes a spinal reflex. And the brain's like, don't do that movement. Protective. Always in weakness. Now, people are like, but no, I'm not weak there. I don't need to strengthen those. I'm already tight there. Not accurate. Now, tremors are different. If it's a tremor because of Parkinson's, that's dopamine related. That's an issue at the basal ganglia. There's also cerebellum tremors. So a lot of times when you're doing exercise, we see it a lot in Pilates, but I see it in other things where people will be almost like tremoring. I always say the difference, a good way to assess, is this a neurological tremor, meaning like it could be Parkinson's or something we can't control, versus a cerebellum, is when you stop moving, the tremor will stop. When you have Parkinson's, when you stop moving, the tremor doesn't stop. It's a resting tremor. So what that would indicate is people are like, oh, that means you're building a new muscular pathway. Your brain's trying to figure it out. Yes, and it can't figure it out. It doesn't have enough sensory info. So when you're tremoring during an exercise, it indicates your cerebellum is not getting enough information. The cerebellum requires quality sensory information. So if the cerebellum's not getting good information, so if you're like reaching for something that the cerebellum assessment says they'll touch your nose, touch something else, it's because the brain doesn't really know where the hand is in space in relation to what you're touching. But you can change the sensory environment to fix that. Although doctors tell me it's impossible, I take a woman with a cerebellar tremor and I have it on video and I show them. And they're like, huh. Last but not least, a tic. In my opinion, a tic is a neurological response. I also believe it's a safety thing. Now, I don't mean safety, saber-tooth tigers don't exist anymore. Any sort of tiger is chasing you. Your brain is protecting you, or it's sensory overload. And it's almost like the record is skipping. Similar to like a seizure. So a seizure is just a misfire, an overfire. Okay. It's terrifying, right? But they're not the same, but it's the brain's response to what is currently happening. So identifying, I love what you said, we call them yellow and red lights, identifying yellow lights, having strategies. And when the strategy doesn't work, other strategies, right? So it's creating strategies and what we call DMAs, daily movement activators, not exercises. So whatever sensory strategy worked in your movement, it might have been that tongue. I had you bite your tongue in every exercise. So I'm going to tell you, when you're washing dishes, I want you to bite your tongue. Let your body move, but keep your tongue still. It's just a way to activate the cranial nerves, okay? Whatever sensory strategy, we would use that, okay? So everybody has tics for different reasons, but I like to simplify it as your brain don't like what the hell you're doing, doesn't like the environment, doesn't like what you're doing. And we'll also see this in autism, outburst, anger, violence. Often when that happens, it's because whatever you're doing is really bothering that person. You might be talking to them, but your voice sounds at a pitch that makes them want to scream. Okay. Now, someone who's not autistic is emotionally connected towards responses to people, right? So if you're annoying me, I might be a bitch and tell you, or I might not be. See how I say a bitch? Like, is that being a bitch, or is that telling people what you need? Or I might just do something, or my body will be uncomfortable in that situation, where other people, they might not be able to control that. So they have it as an outburst. They might punch you because what you're doing is hurting them. You might not think what you're doing is hurting them, but what you're doing is hurting and aggravating them. You don't have, and that's where people get so mad. They're like, all I did was tap them. Well, that tap feels like a knife. So that is how I would kind of describe all the difference. But at the end of the day, to me, it boils down to the same thing. How can we figure out a way to make your brain safe, not by just meditating or talking about it or breathing, actually making sure your proprioception, visual, and vestibular are all aligned.
I think that all makes a lot of sense. And taking your course now is moving very high on my list.
Yeah, well, reach out when you do. And for anybody here who is looking for a movement professional, we'll call Raquel. But we have Neuro Studio teachers all over the world. There's 3 levels. All our level 3 teachers are approved to do Zoom. I do most of my sessions on Zoom now. 85% of my sessions are on Zoom, and my clients are higher levels of disability, complex cases. Before COVID, I would have thought it was impossible. I'll be honest. I screamed during my first Zoom session, and it was one of my stroke clients, young stroke clients. He said, let's try it. And I proceeded to scream at him for 50 minutes. He's like a little brother to me. Not scream at him, but I didn't have the words for what I wanted, but it made me a better teacher. And I find, I'll use him for his example. His progress, decreases in spasticity of movement were more over the year. In a year on Zoom over COVID, he made more progress than he had in his past 14 years of doing stroke-related therapy and working with me for 3 years. Because
unbelievable.
We had to use these techniques. When I was in person, I could facilitate more change with my hands. And what I realized is I was acting as my client's cerebellum. So when I wasn't able to do that, I actually had to use these methods in a different way, which made me a much better teacher, but I wasn't good at it at first. Oh my God. And the reason why I did it was because my husband was in grad school, and my business, we used to teach in-person courses twice a month all around the world.
Yeah.
That imploded over COVID. So either I pivot my business and figure it out, or we would lose our home. So it was out of necessity, because if I didn't have to do Zoom sessions, I would have probably never tried.
But
so
then look
reach
at
out
the
to
value
Raquel.
and the skill that gave you.
Yeah, but even if they're not near you, still reach out. You can do this stuff over Zoom. But if you want somebody like-minded to Raquel near your area, we do have Neuro Studio teachers all around the world. Reach out, find the best person for you.
This exists. It exists. It exists to find somebody who understands neurological movement. It exists.
And the unique human condition.
And the unique
Being a human is
condition.
not
It's true.
easy.
Being a human, peopling is hard sometimes.
Oh my God, it's so hard. Like, did you remember, like, I wasn't always an old soul. I couldn't wait to grow up. And I'm like, ugh, adulting's the worst.
No, I think I'm still a kid. I'm
looking right here in our room. We have a little water mold damage, and every day we're waiting for the insurance to prove it. Every day I look at it, I'm like, ugh, I've got to deal with that. Wouldn't it be nice to be like, hey, Ma?
I remember the first time I had to get my own spider. Like, no, me? All right, I'll do it.
But thank you for letting me rant and rave and curse a little.
You know what? Whatever's going to come out is going to come out. I can't thank you enough. I will put all of your links in the show notes here. Reach out. And I'm so grateful to share your expertise and how you're pushing the envelope with the world. I think what you're doing is beyond incredible. It's necessary, and you're putting science behind it.
Yeah, and ditto for what you're doing. And sometimes don't wait for the science. If you're doing something that works, just keep freaking doing it. Like, who cares? And I get sometimes annoyed when I was at a freaking event and these movement professionals were talking at me, and I was like, well, I do it this way. And he's like, well, why? I go, because I don't settle for okay. I want fucking great for my clients.
I love that. It's true.
I don't know. I don't know. And I am sorry. I want to apologize to everybody who has Tourette's, of the other humans. I think we're just curious. Humans are curious. We ask too many questions, but not the right ones. And I think I see with my young clients who have higher levels of disability from MS, people are like, what's wrong with you? Why are you walking like that? Rather than, is there something I can do to help? And they'll like almost help too much, as if they're like invalids. And they're like, no, I can do it myself. Like, it's asking different questions. Hey, is my voice a little too loud? Or am I standing too close to you? It's
asking different questions. I'm trying to help push this narrative that tics and Tourette's can be interesting, but they're not entertaining. They can be
No, but I think
interesting. There's a body puzzle to this that's fascinating, but ask the right questions.
because people have made it a bit of a joke, you see it in movies. The kid
Yeah.
with Tourette's is the funny kid, or he's either getting made fun of or he's the class clown. It's like you can be the class clown, yes, and I think there was a lack of understanding of what it really was. I mean, would you agree?
Hugely. I couldn't agree more. I think the advocacy groups are doing an amazing job trying to
Is the
help
prevalence
explain.
higher for Tourette's? Is it a growing condition? Is it state leveled off, or do they
No, this
not
has been
know?
around since the 1800s. I think
No, no, I
people are
mean, but
getting
has like they'll say like, oh, there's higher levels of autism, and I say, or are people just understanding what it was?
I think
I
people
have
are
family.
understanding it and getting a proper diagnosis earlier. We had a neurologist on who was telling us that the average time from tics coming on to diagnosis is between 3 and 11 years.
Yeah,
Between
it's
3 and
similar with
11 years.
MS. It's similar with a lot of. Now, my question to you also is, I'm not educated on this, and sorry to go longer, but is it the case that when you have Tourette's, the doctors do medication first rather than these sensory strategies or things you want to do, or do they not prescribe medication? Like, what are doctors offering people for Tourette's?
There's no direct Tourette medication. There's a
Okay,
lot of medications available. Um, so
is
medication
that what
isn't.
they're really prescribing? Those kind of things to maybe help?
It is up to the individual completely. There's CBIT therapy, cognitive behavioral intervention for tics.
Yeah,
There's medication, and then you see your neurologist. And then at that point, it's really just symptom treating.
yeah, you
There's
got to get linked up with more neurologists. They need to know what you're doing. And I love when people always say that to me. I'm like, yeah, I'm doing my best. Give me a freaking minute. I'm
no,
one
no,
woman.
but there is a great neurologist who's really pushing electromagnetic work, and she's doing
Yeah.
some really incredible work with the Minnesota Tick Lab, Dr. Christine Connollia. So
But like
they
even
are
just I'm saying, let's stop talking about other people. Like what you're doing movement wise, like that's and like the cool thing about that is, yeah, it'll help with your ticks, but it'll also help with other things too.
agreed. Help with focus,
Yeah.
help with confidence, help with understanding your triggers,
Yeah,
help with
maybe
sleep.
we'll
Sleep is huge.
yeah, yeah. Getting a post out, getting information out via you or something like that of that this is an option for Tourette's. Like
Yeah.
this is a treatment. Maybe it's not scientifically proven and peer reviewed, but like
Yeah, maybe one
making
day.
making teenagers feel better and more comfortable in their body. I mean,
I
even for
would have
kids
loved
without
to have gone through
Tourette's.
a program like this. It's true for any kid, especially, after the COVID years and everybody was in. I know my own clientele, when we started training more in person, or I had clients come back to me, everybody was having calf strains because everybody was sitting. Nobody was moving their feet and their ankles. I would say that was the number one injury. The number two injury was shoulder related
Interesting.
from pickleball. It, but yeah, learning, I mean, we all have a body. We should all learn how it works. There really needs to be some.
It's a much more interesting science. I wish
Yeah,
I initially went to college to be a history major because we didn't take this kind of science. We took biochem, physics, all that stuff. I'm like, what if they taught anatomy and physiology in high school? And I know some do now, but
right.
I'm 43. They did not when I was in high school.
I've got 40 in the fall here. I don't believe they offered it. I mean, biology, yeah,
I didn't even know
but
what occupational therapy was. It was
I
physical
didn't
therapy,
understand.
and I didn't. That's why I did exercise science because I did not want to be a physical therapist. Because I went to physical therapy as a kid for my knees
Okay,
because I had a lot of knee pain because
right.
of the grosser, and it didn't help at all. And it was like annoying. And they put like stim on my leg and made me do exercises that made me feel worse because I'm like, I can't really move it. So I was like, I do not. And I was like, that is the most boring job. No offense to PTs listening to this. PT has changed a lot, but
PT's changed so
that's
much.
not what I want to do.
I wish I understood what what occupational therapy was more. I really thought it was just fine motor skills, and it's so much more involved. I've had two really incredible occupational therapists on the podcast as well. Um, Physical therapy, I didn't like being confined by insurance. You got your
I don't
15
like
minutes.
rules. I don't like
Yeah,
rules.
that.
You
I'm
know.
instead of paying all the money to go to PT school. I paid it into different certs.
Good.
So
And I say to a lot of young kids to do that because you'll make more money coming out of school. You won't have as much debt. And, I think you're coming out with a doctorate, no real experience, making 50 to 60, and you have all this debt. And then you have to do further trainings to learn the fine tune things. But, to each their own.
to each their own, but it's changing, and it's allowed us to have this conversation. So thank you for also chasing what you knew was what's the word? What's for
Asking
chasing
that, well, I think it
chasing the
goes back to some of
why.
the questions
Yeah,
like why?
chasing the why.
Yeah.
Awesome. I can't
Well,
thank you enough, Megan. Let's do this
no,
again.
no. Yes, please, please, please. And we'll connect. And thank you to all your listeners. Um, you know, don't settle for okay.
Don't settle for okay. Don't settle for okay. And we'll leave it at that. Look for her information in the show notes. You can find her at the neurostudio.com. And again, there's a lot of Neuro Studio instructors all over. Do you have a network? Like, how do you find a Neuro Studio instructor that's
So it's
close?
on our website. We have a find the teacher page
Okay.
where you will see what level. So if they did level one, they did our Pilates for neurological conditions to understand neuro conditions and symptoms. And if they've done level two, they've done my advanced training where they learn the assessments and stuff like that. Level three is someone who's done a year mentorship with me and my business partner. So we've got some great level one teachers that just kind of want to go in a different direction, So um, most are Pilates based teachers, but we have a lot of OTs, PTs, personal trainers, because the beauty of, and if you don't want to learn about neuro conditions, like if you just want to kind of learn these techniques to work with all humans, because we all have a neuro condition,
Yeah.
right? The level, we're kind of changing because it's not really level one, two, but the advanced neuro techniques course is the course you should take because it applies to all humans. I do demo on people with neuro conditions who have spasticity and stuff like that because something that always annoyed me was they teach us these techniques and we're demoing them on our bodies where we have no restrictions. Yet, like,
Right.
I'll see these exercises on Instagram. Do this for someone who has balance issues. Yet the physical therapist or the person demoing isn't even doing it right. So I demo on clients who actually have things so you can see how the assessment changes it in real time. So it really helps the practitioner a little bit more, but I use the same techniques when I work with professional athletes, people who play pickleball,
Yep.
my ex-athletes like my husband, people who never played a sport, people on the spectrum, people not on the spectrum, people with neuro conditions. It's the human condition, so it's
It
pretty
is the
fun.
human condition.
Yeah.
Megan,
So
thank you. Thank you.
no, thank you, hon.
All right. We will talk again soon. We love providing a platform for sharing ideas about living with Tourette syndrome and other tic disorders. While we strive to keep the content evidence based, please understand that exercise science, information about Tourette syndrome, and its co occurring conditions are constantly evolving. The content shared in this podcast are for informational purposes only and should not be considered medical advice. By listening to this podcast, you agree to not use the information as a substitute for professional medical advice or treatment for yourself or your child. As always, consult your healthcare provider before making any medical decisions or starting any treatments related to Tourette syndrome or other health conditions, which also includes mental health. This disclaimer also applies to any guests or contributors to the podcast. TickFit and the podcast team do not take any responsibility for any actions taken based on the information provided. Our goal is to educate, support, and raise awareness, not to diagnose or treat any medical condition. Thanks for listening.